Let's kick off the show from the health sector. The Lagos State Health Insurance Scheme has been expanded to accommodate more services, all thanks to Governor Babajide Sanwo-Olu, who has just launched the Ilera Standard Jaara Health Insurance Plan and also commissioned 5 Ilera virtual health booths for easy access to quality and affordable healthcare services. Please take a look.
To the formal launch of Ilera
medical experts from the public and private sector converge on Lagos Continental Hotel to witness the unveiling of the Ilera Standard Jaara, a social health insurance plan for residents, as well as the provision of virtual booths that will help attend to medical cases at any location in the state. Achieving this milestone has not been easy for the State Health Management Agency, and the boss in charge explains why.
When we rebranded in 2021, we started with the standard plan under the Ilera program. That plan essentially has more of primary care and some of secondary care. For instance, you have a headache, malaria, you want to see the doctor, it covers you. You have hypertension, diabetes, you're asthmatic, you're a sickler, or you even have SLE, we cover you. You want to do an X-ray, you need diagnostic or laboratory services, we cover you. You can have dental care, so scaling and polishing, tooth extraction, dental X-rays under the scheme. You can get glasses, for instance. You can get cancer care up to 1 million if you've been on the plan for 2 years. We have surgeries. You can have an appendicectomy done, a herniorrhaphy. And we are also very big on maternal and child care, so childhood illnesses we cover, antenatal, delivery, and even cesarean section we cover under the scheme. You can get blood transfusion. You can get feeding for 1 day. Shall I continue? You can see it's plenty. And it's just for a measly price of 8,500 till date. That is for one person per year. We enhanced that and we moved up forward to what we call the Standard Plus plan, which included things like some level of dialysis. We were able to increase the number of specialists that you can see for consultation. And then we are here today to launch our new baby called the Standard Jaara plan, which is now a wider bouquet of services, of course, for something that is slightly more expensive because we have put in quite a lot. So we have included things like eye surgery. Cancer is now up to 5 million if you are under the scheme. We have increased the days of admission. We have added more diagnostic services and drugs. You will see that when we present today, it is a very, very robust plan, and it's still very affordable for the price that we are asking negotiants to pay for it, which is 15,000.
This new health initiative has brought the state governor, Babajide Sanwo-Olu, his deputy Kadri Hamzat, to the venue to join other state executive cabinet members for the ceremony. Chairman of the Lagos State Health Management Agency elaborates on LASHMA's use of technology in its operations to ensure seamless service delivery.
In LASHMA, we leverage on technology right from the point of registration, uploading on platform, payment processes, claims processes and management, up to assessing care at the hospital and identifying the vulnerable among us. Our 24/7 customer service center is also not left behind, as technology has been deployed to ensure that customers' complaints are well received, processed and stored.
It's also an opportunity for officials of LASHMA to tell the public about Ilera Standard Plan and Telemedicine.
And Standard Jaara came to being as a result of the combination of some factors, like the feedback we get from customers, and of course, a lot of extensive customer perception survey that we undertook for some time. With the following intent, we have developed the Standard Jaara 1, to respond to customers' demand, to cover more disease burden, to widen social safety nets, to ensure a win-win relationship with stakeholders.
Use of telemedicine by the public servant through Telemed and the use of the booths by the university students has enhanced our ideas and our experience with telemedicine. Now, because of this, some benefits were discovered. What are these benefits? So we have prompt access to healthcare services, improved health education, equitable distribution. It means that irrespective of a socio-economic status, you can have access to healthcare. Access to mental health services. This was a very important feature of telemedicine during the use of Telemed at the height of the pandemic. Very, very important, as we all know. We were all cooped at our home and people were running out of their minds. And then you have extensive coverage anybody, anywhere, irrespective of your geographic location, you can have access to telemedicine services. The booths are supposed to be complementary. They are not clinics. They don't replace our hospitals. But in case of an emergency, every enrollee that visits will have the opportunity to be referred to the nearby hospital for them to have health care under the standard Jaara plan within the first 48 hours.
The Deputy Incident Commander, Professor Akin Abayomi, who oversees the duties of the State Ministry of Health, commends Governor Sanwo-Olu for changing the face of the health sector.
Mr. Governor has signed the executive order which domesticates the NHIA law in Lagos, ensuring that we encourage all Lagosians to carry a social health insurance as a form of social health protection. All this done by you, sir, in your very short time in second tenure and part of your first tenure, and it all qualifies you as the grand ambassador of universal healthcare coverage in Lagos, Nigeria. Thank you very much.
Congratulations, sir.
When Governor Sanwo-Olu takes the podium, he pleads with the informal sector to take advantage of the new initiatives and enroll on Ilera in order to reduce out-of-pocket medical bills.
We have enrolled the public servants in the Ilera scheme, with the government covering 75% of all their premiums. Starting in August 2024, all Lagos State pensioners will receive the free one-year Ilera coverage, which will ensure their access to health care even while in retirement. We're doing all this to further our universal health coverage goal. This new insurance plan offers additional benefits and peace of mind by reducing the financial burden on medical bills. In this plan, we have heavily subsidized the health insurance premium to ensure that everyone can access health care. I call on the informal sector, which constitutes over 70% of the population in the state, to seize this opportunity and enroll on the Ilera in order to reduce your out-of-pocket expenses and the huge payment of medical bill, which we all know that is common around here. I invite the informal sector also to come on board and ensure that their employees are registered and enrolled on our Ilera, as this will automatically reduce the expenses of the companies, especially for the payment of medical bills. Let me add here that the enforcement team to handle the implementation of the Lagos Health Insurance Scheme law and the domestication of the National Health Insurance Authority Act has been constituted, and they've been well trained. Even though this administration believes more on enlightenment, engagement, and collaborative effort rather than enforcement, the law still stands to be implemented and obeyed. Therefore, violators of this law will not go unpunished when the enforcement takes its full course.
They are both ambassadors of Ilera.
The number 1 and 2nd citizen of the state are decorated as the Grand Ambassadors for Universal Health Coverage and Ilera. The launch of the Ilera Standard Jaara Health Insurance Plan and the commissioning of virtual booths installed in 5 locations across the state may indeed be a bold step towards achieving universal health coverage in Lagos State.